If you are a kidney patient, your doctor may have prescribed you several medicines, all of which are crucial for your treatment. But do you know what each medication does and how it helps your condition? In today's video, let's understand your kidney medications, how they work, and why they are important for your kidney health. In the end, we will also guide you on how to take them safely. By having this knowledge, you can treat your kidney disease more efficiently. So let's begin. The first medicine on our list that your doctor may have prescribed you is for blood pressure control. You might be wondering why your doctor would have prescribed blood pressure control medicine in your kidney treatment plan. Actually, high blood pressure is one of the major risk factors for kidneys. In fact, it is the second most common cause of kidney failure. It can constrict, narrow, and damage the blood vessels throughout the body, including in the kidneys. This can reduce blood flow to the kidneys, make it difficult for them to function properly, and strain them, which can lead to kidney disease or failure. So, to prevent this major risk factor, blood pressure control medicine is one of the most important prescriptions in kidney disease treatment plans. The first type of blood pressure medication you might get prescribed is angiotensin-converting enzyme inhibitors, or simply ACE inhibitors, such as lisinopril or enalapril. These medicines work by blocking the action of an enzyme called ACE, which plays a key role in the production of a hormone called angiotensin II. Angiotensin II normally causes blood vessels to tighten, increasing blood pressure. By reducing the production of this hormone, ACE inhibitors can help relax and widen blood vessels, lower blood pressure, and improve blood flow to the kidneys. If ACE inhibitors are not suitable due to any condition, your doctor might prescribe angiotensin II receptor blockers, or ARBs, such as losartan or valsartan. Instead of blocking the production of angiotensin II like ACE inhibitors, ARBs block the receptors that angiotensin II binds to, preventing its effects. This also results in the widening of blood vessels, lowering blood pressure, and improving kidney function. Another class of medication your doctor may prescribe is calcium channel blockers, such as amlodipine. These medications work by blocking calcium from entering the muscle cells of the blood vessels, which helps the blood vessels relax and widen. This also helps to lower blood pressure and improves blood flow. Moreover, beta blockers, such as metoprolol, may also be prescribed for patients with kidney disease, especially if they also have heart-related conditions. Beta blockers work by blocking the effects of certain hormones, like adrenaline, on the heart and blood vessels. This causes the heart to beat slower and with less force, which can lower blood pressure and reduce strain on the heart. Beta blockers can be especially helpful for patients who have both high blood pressure and heart problems, such as arrhythmias or heart failure. The medicine number 2 on our list your doctor may prescribe for kidney disease is for the treatment of anemia. Anemia is a common condition for kidney patients, as the kidneys play a crucial role in producing erythropoietin or EPO, a hormone that stimulates the bone marrow to produce red blood cells. When the kidneys are not functioning properly, they can't produce enough EPO, which can cause a shortage of red blood cells and cause anemia, which shows symptoms like fatigue and weakness. To treat this, your doctor may prescribe medications like erythropoiesis-stimulating agents or ESAs, such as epoetin alpha or darbepoetin alpha. ESAs work by stimulating the bone marrow to increase the production of red blood cells. This helps to raise the hemoglobin levels in your blood, improve oxygen delivery throughout the body, and reduce the symptoms of anemia, such as tiredness and weakness. Moreover, in addition to ESAs, your doctor may also prescribe iron supplements, either oral or intravenous, to treat iron deficiency, which is common in kidney patients with anemia. Iron is a critical component of red blood cells, and without enough iron, the bone marrow cannot produce red blood cells efficiently, even if EPO levels are sufficient. Oral iron supplements are often used, but if absorption is a problem or the anemia is severe, intravenous iron may be required. Iron supplements help ensure that the body has the necessary building blocks to produce red blood cells and improve the effectiveness of ESA treatment. To take iron supplements effectively, take them on an empty stomach, about an hour before meals, and avoid dairy, coffee, or tea at the same time. Medicine number 3 is for hyperphosphatemia or high phosphate levels. Hyperphosphatemia is a serious problem for people with kidney disease. When the kidneys are not working properly, they cannot filter out excess phosphate, which can cause it to build up in the bloodstream. This can cause severe complications such as heart disease, weakened bones, and further kidney damage. If left untreated, high phosphate levels can also result in calcium deposits in the blood vessels, heart, eyes, and lungs, and can increase the risk of heart attacks and strokes. So, to treat hyperphosphatemia, doctors commonly prescribe phosphate binders. These medications work by binding to phosphate in the digestive system and preventing it from being absorbed into the bloodstream. Once bound, the phosphate is then excreted through the stool. There are two main types of phosphate binders. First is calcium-based binders, like calcium acetate, which bind phosphate in the stomach and intestines and help to remove it from the body. Second is non-calcium-based binders, such as sevelamer and lanthanum carbonate, which are often used for patients who may not tolerate calcium-based binders. Sevelamer works by binding phosphate without being absorbed into the body, and it also has the benefit of lowering cholesterol levels. On the other hand, lanthanum carbonate can help improve bone health and reduce calcification in blood vessels. Medicine number 4 is for hyperkalemia or high potassium levels. High potassium levels in the blood are also a serious concern for kidney patients. The kidneys are responsible for filtering excess potassium from the bloodstream, but when the kidneys are not functioning properly, they are unable to remove enough potassium, which can lead to a dangerous buildup. High potassium can cause symptoms like muscle weakness, irregular heart rhythms, chest pain, and even life-threatening conditions such as cardiac arrest. To manage this condition in kidney disease patients, potassium binders are often prescribed. These medications help reduce potassium levels by binding to excess potassium in the digestive tract and preventing it from being absorbed into the bloodstream. Sodium polystyrene sulfonate is one such medication, which exchanges sodium ions for potassium ions and allows excess potassium to be eliminated through the stool. Pataromer is another potassium binder that works similarly but is less likely to cause stomach issues. Medicine number 5 is for bone health. In chronic kidney disease, the kidney's ability to regulate vital minerals like calcium and phosphate is often degraded, which can lead to CKD mineral and bone disorders, or CKD-MBD. This condition affects bone health, causing imbalances that can weaken bones, increase the risk of fractures, and even lead to harmful calcium deposits in blood vessels and organs. To manage CKD-MBD and promote bone health, doctors often prescribe one of the two medicines, vitamin D analogs and calcimimetics. Vitamin D analogs, such as calcitriol and paracalcital, help to regulate calcium and phosphate levels. These medications support the absorption of calcium from the gut and help to control the overproduction of parathyroid hormone, which can negatively affect bone strength. Calcitriol is the active form of vitamin D, while paracalcital is a more targeted version used specifically in CKD patients. On the other hand, calcimimetics, like cinacalcet, helps lower excessive PTH levels by making the body more sensitive to calcium. This helps balance calcium and phosphate levels, reducing the risk of bone disease and calcification. Medicine number 6 is for metabolic acidosis. Metabolic acidosis is a condition where there is an excessive accumulation of acids in the blood, which can occur for various reasons, including kidney disease. This condition results in lower pH and bicarbonate or HCO3 levels in the body, which can cause disruption in the body's normal acid-base balance. When metabolic acidosis becomes severe, it can have serious effects on the cardiovascular system, causing issues like heart arrhythmias and low blood pressure. One common treatment for metabolic acidosis is sodium bicarbonate, which helps neutralize excess acid in the body and raise the blood's pH to a safer level. Sodium bicarbonate, also known as baking soda, works by releasing bicarbonate ions that bind with hydrogen ions, the source of acidity to form carbonic acid, which is then broken down into water and carbon dioxide and expelled from the body. This process helps restore the body's acid-base balance. Medicine number 7 is for fluid retention and edema. As kidney function declines, the body may struggle to maintain the right balance of fluids, causing fluid buildup, particularly in the legs, abdomen, and lungs. This condition, known as fluid retention and edema, can cause discomfort and worsen other health problems, such as high blood pressure and heart failure. To manage fluid retention, doctors often prescribe diuretics, which are medications that increase urine production to help the body eliminate excess fluid through urine. There are two main types of diuretics used in kidney disease treatment: loop diuretics and thiazide diuretics. Loop diuretics, such as furosemide, are often the first-line treatment for fluid retention in advanced kidney disease. These drugs work by blocking sodium and chloride reabsorption in the loop of Henle in the kidneys, promoting the excretion of water and sodium, which helps reduce swelling. Loop diuretics are particularly effective in patients with more severe kidney dysfunction and fluid overload. On the other hand, thiazide diuretics are less commonly used in advanced CKD, as they may not be as effective in patients with significantly reduced kidney function. However, they can still be helpful in milder cases of fluid retention. Medicine number 8 is for diabetes management. For kidney patients with diabetes, managing blood sugar levels is crucial, as high blood sugar can further damage the kidneys. One class of medications often used for this purpose is SGLT2 inhibitors, such as empagliflozin and canagliflozin. These drugs work by blocking the sodium-glucose cotransporter 2 or SGLT2 in the kidneys, which reduces the reabsorption of glucose and allows excess glucose to be excreted in urine. In addition to SGLT2 inhibitors, insulin and other diabetes medications may be prescribed but adjusted for kidney function. Medicine number 9 is for dyslipidemia. Dyslipidemia is an abnormal level of lipids or fats in the blood, which includes high levels of cholesterol and triglycerides, or low levels of HDL or good cholesterol. It is commonly seen in people with chronic kidney disease, as kidney dysfunction can interfere with lipid metabolism and can cause an imbalance in blood lipids. This condition increases the risk of developing cardiovascular diseases, such as heart disease and stroke, because excess cholesterol and triglycerides can build up in the blood vessels, forming plaque that narrows and hardens the arteries, a condition known as atherosclerosis. Dyslipidemia is particularly concerning in kidney patients because they are already at a higher risk of heart-related issues. For this, medications known as statins are prescribed. Statins help lower LDL cholesterol, the bad cholesterol, and reduce overall cholesterol levels, which in turn can help prevent the buildup of plaque in the blood vessels, which is especially important for kidney patients who are at higher risk for cardiovascular issues. Medicine number 10 is for secondary hyperparathyroidism. Secondary hyperparathyroidism, or SHPT, is a condition where the parathyroid glands produce excess parathyroid hormone, or PTH, in response to low calcium levels in the blood, commonly caused by chronic kidney disease. This imbalance can cause weakened bones, bone pain, kidney stones, and other symptoms. To manage SHPT, vitamin D analogs, such as calcitriol, are commonly prescribed. Calcitriol is an active form of vitamin D that helps regulate calcium levels in the body by increasing calcium absorption from the intestines and helping release calcium from bones into the bloodstream. This reduces the parathyroid gland's release of PTH, addressing the underlying cause of SHPT. Other vitamin D analogs like alpha-calcidol or paracalcitol may also be used, depending on the patient's needs. Medicine number 11 is for symptom management. For kidney disease patients, symptom management is an essential part of treatment, and various medications may be prescribed to help manage discomfort. The two common among them are pain relievers and antipyretics. Pain relievers, such as acetaminophen, are commonly used to control pain, and antipyretics are prescribed to help manage itchiness, a common symptom in kidney disease patients, particularly those with end-stage kidney disease or undergoing dialysis. These medications help alleviate discomfort caused by dry skin or the buildup of waste products in the body that the kidneys are no longer able to filter effectively. And these are some common kidney medications. When it comes to their dosage, most medications need to be adjusted based on your kidney function. The dosage of a drug is often determined by the glomerular filtration rate, or GFR, which is a measure of how well your kidneys are filtering waste from the blood. If your GFR is low, your kidneys may not be able to clear the medication effectively, leading to a buildup of the drug in your system. This can cause side effects or even toxicity. For this reason, doctors typically adjust the dose or prescribe medications that are safer for individuals with kidney problems. So take these medicines as recommended by your doctor. But that's not all. It's also important to avoid some medicines because some medications can worsen kidney function or increase the risk of further kidney damage, especially in individuals already dealing with kidney disease. The first one among them is nonsteroidal anti-inflammatory drugs, such as ibuprofen, which are commonly used to reduce pain and inflammation. They can interfere with kidney function by reducing blood flow to the kidneys, potentially causing kidney damage over time. Second is aminoglycosides, a class of antibiotics that can also be harmful to the kidneys when used for prolonged periods or at high doses. Additionally, certain contrast agents used in imaging tests, like CT scans, can be toxic to the kidneys, especially in those with pre-existing kidney conditions. And there, you have understood your kidney medications. Thanks for watching. If you found this video helpful, please like it and subscribe to our channel for more informative content. See you in the next video.